With just days before Thanksgiving, everyone over the age of 18 is now eligible for a COVID-19 booster shot. The FDA and CDC approved the move last week, opening up booster doses to millions more Americans. And with many Americans planning to travel for Thanksgiving and see family over the holidays, doctors are encouraging patients to protect themselves and their loved ones. Health officials say the booster becomes effective immediately and reduces the chances of getting a breakthrough COVID infection over the holidays.
Obviously, we've been doing this now for a year, and so there may be some waning immunity in some people where the boosters are helpful, and then there are those folks who've not been vaccinated where I think there's still a very good opportunity to get vaccines, because I don't think we're out of the woods just yet.
Boosters and initial doses are widely available at StarMed, the county health departments, through the hospital systems, and at pharmacies like CVS and Walgreens. Experts drawing a link between COVID-19 cases in children and a serious condition known as MIS-C, or multisystem inflammatory syndrome, in children. It's one reason doctors say getting kids vaccinated is so important. State data shows that in North Carolina, 11% of kids ages 5 to 11 in the state have gotten their first shot. And in South Carolina, almost 6% of that population has. WCNC Charlotte's Chloe Leshner is at StarMed Healthcare in Northwest Charlotte with more from the experts.
Nearly 13,000 kids in Mecklenburg County have come to a clinic like this one to get the first dose of the Pfizer pediatric vaccine. Doctors say the benefits far outweigh the risks, and they're hoping more parents will make the choice to get their kids protected. From the start, it's been clear older people are the most vulnerable to COVID. While most kids will have a mild case, doctors warn not all will.
It's not a mild disease in all children. There are a certain percentage of children who get hospitalized, and of those, a third of them go into the intensive care unit. So that's a pretty high proportion.
A rare but serious complication from a COVID infection is multisystem inflammatory syndrome in children. According to the CDC, the majority of those cases are in kids ages 5 to 11.
We saw 2 last week here, for example. So we know that number continues to grow, and those kids are at high risk for heart disease.
Many parents who have not gotten their young kids vaccinated say they're concerned the shots could cause adverse side effects like myocarditis or swelling of the heart muscle.
And that's what we've sort of been comparing to when people are worried about vaccines causing heart disease. It's much more likely to happen with COVID because of the MIS-C complications in children.
With a possible surge in cases coming after the holidays, experts are hoping more parents will seek out the answers to their questions.
We have adequate information to tell us that these vaccines are not only effective, but they're exceptionally safe.
Kids' COVID vaccines are widely available throughout the county. Between Atrium and Novant Health, about 40 pediatricians' offices have them. By the way, you do not need insurance to get the COVID vaccine. In Charlotte, Chloe Leshner, WCNC Charlotte.